A major cause of strokes is atrial fibrillation. Dr. Eric Good discusses this irregular heart rhythm condition, its symptoms, and treatment options that can help individuals avoid possibly dangerous consequences.
Atrial fibrillation is a chaotic electrical rhythm which emanates from the top chambers of the heart called the atrium. It involves an electrical storm, if you will, in which impulses whirl about the top chambers and send signals to the bottom chamber very rapidly, sometimes fast as 400 to 600 beats per minute. Some patients have few symptoms during atrial fibrillation. Others may experience symptoms such as palpitations or fast, irregular heartbeats. Some patients will describe shortness of breath, perhaps chest pain, dizziness, or lightheadedness. The symptoms can really vary from one individual to another. During atrial fibrillation, blood can stagnate or pool in different areas of the heart, in particular a little ear of the heart called the left atrial appendage. If these blood clots form and then go off into the body, they could have a chance of going into the brain and causing a stroke. For patients who have atrial fibrillation and risks of stroke, who may not have very many symptoms during atrial fibrillation, one treatment strategy is a strategy called rate control in anticoagulation. In this strategy, patients are given medications to help keep their heart rates in the normal range, even though they're in atrial fibrillation. Another treatment for atrial fibrillation for patients that's becoming more and more popular is a left atrial ablation procedure. In this procedure, catheters are inserted through the veins in the groin and advanced into the heart to the left atrium. In the left atrium, various catheters can be used to zap the electrical rhythms that lead to the atrial fibrillation and restore a normal, regular heart rhythm. We know that perhaps as much as 90% of the clots that form in the heart that go on to cause strokes form in an area called the left atrial appendage, which is sort of a sock-like structure that hangs off the top left chamber of the heart. There's a new device called a Watchman Device that's currently being investigated, which is deployed through catheters initially inserted into the groin. They go up into the heart, cross over into the left chamber, and then we position this device, the Watchman Device, in the left atrial appendage. It has little barbs on it, and it serves to grab onto that sock-like structure and hold this device in place. Eventually, the body heals skin over that and thus prevents clots from entering that area, and the hope is from causing strokes. This is an exciting new technology because it would potentially allow patients who would otherwise need to be on blood thinners for the rest of their life to come off of blood thinners and also not have the risks of stroke. For some patients, pacemaker therapy may be the best option for treating their atrial fibrillation. Several pacemakers have capabilities of preventing or terminating atrial fibrillation. The bottom line for patients who have atrial fibrillation and may be at risk of stroke is to be evaluated by their healthcare professional. They can assess the risk and offer a whole variety of treatment options that could reduce the risk of having a stroke.